Hello everyone, welcome to my channel Learn in Minutes, and the topic for today is Chairside Diagnostic Kits. I will be covering up this topic under the following outline: introduction, ideal requisites, types of diagnostic kits, and finally conclusion. Going on to the introduction, as a famous saying goes, correct diagnosis is three-fourths the remedy. It is relatively easy to detect anatomical damage caused by advanced periodontal disease with conventional diagnostic aids. However, chairside diagnostic aids are popular these days as they have potential to identify or detect periodontal infection, its progression, and identification of incipient disease, thereby facilitating management of the periodontal patient and reducing healthcare cost. Also, validation of effective diagnostic requires both identification as well as verification of various biomarkers, and these biomarkers need to be correlated with disease progression. Let us know the ideal requisites of chairside diagnostic kits. They must be rapid, easy to perform, economical, safe to use, comfortable for the patient, less technique sensitive, highly specific, quantitative, non-invasive, versatile with respect to sample collection, storage, transport, and amenable to chairside use. Going on to the types of chairside diagnostic kits. As of now, there are three types and they are designed to measure microbiologic, immunologic or biochemical, and genetic constituents in oral diagnostic fluids, namely saliva and GCF, indicative of health or disease. Let us now see some examples of microbiologic kits. The first one being OmniGene. This was given by Van Arsdale et al. And these are species-specific DNA probe systems for 8 of the known periodontal pathogens, namely P. gingivalis, Prevotella intermedia, A. comitans, Fusobacterium nucleatum, E. corrodens, Campylobacter rectus, Bacteroides forsythis, and Treponema denticola. The next one is Evaluocyte, which is the commercially available immunoassay for chairside detection of 3 periodontal species, that is AA, PG, and PI. It involves the linkage between antigen and membrane-bound antibodies to form an immunocomplex that is revealed through a calorimetric reaction. Next, we have Pareo Scan. It was developed by Walter Loesch and co-workers at Michigan University in the year 1986. The kit utilizes the Bana hydrolysis reaction developed to detect bacterial trypsin-like proteases in the dental plaque. It detects the presence of 3 periodontal pathogens in the subgingival plaque biofilm, namely Treponema denticola, P. gingivalis, and B. forsythis, and is also used for the assessment of halitosis. Beck et al. In the year 1995 used this kit as a risk indicator for periodontal attachment loss. Let us now see a few examples of biochemical or immunological based kits. The first one being Pareo 2000, also known as the diamond probe system. It combines advanced ion selective electrode technology with the standard Michigan O probe. It is intended to measure pocket depth, evaluate presence or absence of bleeding on probing, as well as detection of sulfides in the periodontal pocket. The next example is Prognostic, which was released in the year 1993, detects elevated levels of MMPs in the GCF such as elastasis. We have PerioCheck, which is also another rapid chairside test kit to detect the presence of neutral proteases. Apart from this, we have PerioGuard and PerioWatch, which are based on the detection of an enzyme called aspartate aminotransferase. These tests use different dyes and catalysts to obtain color changes, which is directly proportional to the concentration of the enzyme. The next example is of genetic kits. The periodontal susceptibility test, or the PST, is the most popular in the genetic kits, which was devised by Corman et al. In 1997. Two polymorphisms within the interleukin 1 gene cluster are closely associated with periodontitis. The PST detects the corresponding allele combinations in periodontitis patients, allowing the evaluation of individual periodontitis risk for chronic periodontitis, aggressive periodontitis, therapy resistant periodontitis, also to evaluate relatives of periodontitis susceptibility test positive patients, and to make future strategies for therapy. So, to conclude with, we can say that although a majority of chronic periodontitis cases can be effectively managed using existing diagnostic methodology, it is clearly more desirable to be able to diagnose the active disease as soon as it occurs. And the various chairside diagnostic kits that are available in the market do offer exciting prospects which would make the monitoring of specific sites an attainable goal in the near future. Nevertheless, these new tests definitely need to be benchmarked with the existing gold standards. Thank you.